and now they want to have sex and there is nobody willing to have sex with them. Masturbation is supposed to be taught right from the age of 4.
So we cannot be having you as Dr. Wahome sitting here in front of us, bringing in things that are not in the bill. You should know that masturbation is a natural process of any human being. Because you're the ones who are actually causing so much confusion and denying women and girls the right to reproductive health care.
This is saying that because we see the fetus or the unborn child has a disability, we abort the unborn child. That is,
if you do not understand what sexual rights means, then you would not be able to...
Sure. Below 18, there is no sex. We have been opposing people trying to reduce the minimum age because we don't want our children engaging in sex.
But if we do not orientate this bill to be family friendly, then it is going to be a major problem.
The phrase sexual health is what Dr. Wahome has been trying to say. There are numerous documents. Some of them are policy documents at the international level.
So if it is moving you that 11-year-olds are getting pregnant and having triplets, it should equally move me. But we are not going to deal with it by shelving the bill. We must confront what is in our society. Just the other day I put it in my Facebook that there is a video ongoing of a 12 or 11-year-old girl performing oral sex on a child who looks like 9 years, while another one who looks like it's 10 is performing anal sex on her. And then we say, put aside this bill.
If you could also, instead of just saying, do away with the bill, do away with the bill, give us a different way that you would like to see things phrased, if that's the issue.
We may have totally different views, we may have totally different historical backgrounds, but it's important for you to understand where we are coming from.
During this pandemic, the things we're seeing on WhatsApp going round, where a mother is talking about her own son sleeping with her daughter and her daughter being pregnant because she's going to work and the children are at home. We have to stop wearing blinders. It's not talking about eroding our values. Kanjama, you keep talking about values, our values against their values. Let me tell you, values are values. Our values are not unique. We've even branded the bill with something so negative. I know right now, we're being accused that we have donors and donors and donors and we're talking to donors. Let me tell you, I feel it's the same on the other side. That right now you need to tell the donors, oh, the bill has been shelved, we've won the war. No.
Issues that are contentious, just come up with a suggestion that because of this issue that is contentious, let us use this. We are fighting over the bill. The bill, in my thoughts, the bill should not be withdrawn.
I propose you amend clause 26 and you delete sub-clause 2. Why? Again, it's a very broad and very subjective clause, which then would allow what we call abortion on demand, which personally, I don't believe in that philosophy, because that child, unborn child, is a human being.
I know we keep talking about their sexuality. Here is the problem. Our sexual age for consent may be 18, but our hormones were not given the memo. They will turn on at 12, at 13, or at 10. And so, how can we then wait for these children to turn 18 before we discuss what is pertinent to them? First thing is education, because there's a lot of ignorance surrounding abortion. We need to educate people to understand, even when we're saying we choose abortion, because many Kenyans feel, some Kenyans feel like we need to give people who do unsafe abortions the right to abort, but they don't know what women go through